Welcome back, guys. For those who have not subscribed, I'll keep on reminding you, continue subscribing, liking, sharing our videos, and if you have any condition that you want us to discuss, or if you have a point of concern, you can put it in the comment section and we'll be able to handle it accordingly. Back to our topic. In our previous video, we were discussing about this common disease in infants called neonatal sepsis. In this video, we are going to discuss about the symptoms and diagnosis, or how you can tell the child is having neonatal sepsis. So what are the common symptoms that a child presents with when he or she is infected with neonatal sepsis? One, we have what we call fever. What is fever? Fever simply means high body temperatures. So when your child is having fevers, this can be significant or can show that the child is having neonatal sepsis. Number two, we have breathing problems. When the fever goes up, you will find that the child is having what we call fast breath rate, or breathing in a fast rate. Number three, we have diarrhea. Diarrhea can also show an infection, especially when it reaches the stomach. The child may also have what we call decreased movement. Obviously, even an adult, when you are sick, obviously you will have decreased movement. Number four, we have low blood sugars. Obviously, the child will not be feeding well, so the sugars definitely will go down. Number five, we have what we call reduced sucking. When the child is sick, the child may fail to suck because the infection is affecting all the systems, so the sucking reflex obviously will go down. Next, we have what we call seizures or conversions. When the temperatures go so high, the child may tend to have what we call conversions or fits or seizures. Number eight, we have slow or fast heart rate. I think that I had explained that in the previous point. Next, we have vomiting. Vomiting is always a sign or a symptom of an infection. Might it be a blood infection or infection in the tummy or in the stomach? We may also have swollen belly. The child may also have swollen belly, whereby the stomach distends and increases in size. This might be also a sign of neonatal sepsis. Next, we have what we call yellow skin, and there will be yellow coloration on the skin and the white part of the eye. This is what we call jaundice. Let's go to the next point, whereby we are going to discuss about how we can diagnose, or how a doctor can tell that a child is having neonatal sepsis. One, we have laboratory tests. How does this laboratory test help in diagnosing neonatal sepsis? This is whereby a blood sample can be taken from the child bloodstream and taken to the lab to identify the cause of an infection. Note, and this is very important, blood tests include: one, blood culture. You can take the blood for blood culture and sensitivity. This is all aimed at identifying the cause of this infection or the specific bacteria. Number two, you can do C relative protein. Number three, we have what we call complete blood count. Most people know it as a full hemogram. So they all mean one or more less the same thing. Lumbar puncture and spinal taps. This is whereby spinal cord fluid may be taken to the lab so that the doctor can rule out the specific bacteria causing this type of infection. Stool, skin, and urine cultures may also help arrive at a diagnosis, especially whereby we have a virus like herpes virus. Chest x-ray, and note this is very important. Chest x-ray can also be done if the baby or the child has coughing and breathing system. This is only if the child has cough and breathing problems. So this means that it's not mandatory or it's not a must you do a chest x-ray unless the child is having breathing problems or coughing. The reason being, these ultraviolet rays from the x-ray are always dangerous to the body cells. Another point to note, urine culture tests are done in babies older than a few days. So for a baby, urine culture to be carried, the baby shall have been born and stayed for just a few days, and this can also help the healthcare provider in arriving at a diagnosis. This marks the end of our video today. In our next video, we will be discussing about the treatment modalities available in this kind of a condition or in neonatal sepsis. Guys, let me continue thanking you for the continued support to this channel. It started as a joke, and I can see now we are ending somewhere and we are helping somebody there. It might be your relative, your sister, your aunt, your brother. Let's continue sharing the information. Let's continue sharing the videos. Let's reach as many people as possible, and I know Kenyans will get help from our videos. So guys, thank you for the subscriptions. Road to 10,000 subscribers. Keep the support on. Have a good evening.